The next and fifth step in HRCM Flow process is medical coding, which done on the basis of standard codes assigned by NCCI and LCD. Let's understand this process in details. Step 5. Medical coding. Medical coding is the process of assigning standardized codes, and it is the uniform language that describes medical, surgical, and diagnostic services. Medical coding specialists translate medical documents into codes that determine the cost of patient care. This is a communication between the physicians/hospitals, patients, and the third parties. Medical coding is one of the most sensitive processes of the revenue cycle management preceding a claim submission. Accurate coding increases higher revenues and decreases the denials from the insurance companies. The coding process includes the following steps. First, access patient medical records through secured network using VPN connections. Second, coders review and scrutinize the documents for accuracy and split them into batches for processing. Third, diagnosis. Procedure codes and modifiers are assigned as per the coding guidelines and per client requirements. Fourth, coding is done in accordance with NCCI, National Correct Coding Initiatives, and LCD, Local Coverage Determination, DUT. Fifth, quality checks are in place prior to the charge entry process. Following industry coding standards are used. First, ICD-10-CM, International Classification of Diseases, for diagnosis codes. Second, CPT-4, Current Procedural Terminology, for procedure codes. Third, HCPCS, Healthcare Common Procedure Coding System, to code Level 2 and Level 3 codes.